Hello, everyone. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. What I'm going to speak about today is low back pain and a major contributing factor for low back pain, and that is symptoms, conditions, or dysfunctions in the lower extremity. If something in the lower extremity is not functioning properly, that can lead to symptoms in the low back. The lumbar spine is the medical name for the low back. The lower extremity obviously is the legs. We can speak about the feet, the ankles, the calves, the knees, the thighs, and the hips when we speak about the lower extremity. Low back pain is a common health problem worldwide. It affects approximately 80% of people at some stage in their lifetimes. Low back pain is a major cause of disability. In the athletic population, low back pain is one of the most common reasons for missed playing time. Pain in the lumbar spine may persist for years. There are many factors that can contribute to low back pain, but lower extremity conditions is one of them. Low back pain is a common problem among young basketball players in addition to lower extremity injuries. Compared with players without lower extremity pain, players with lower extremity pain had higher rates of low back pain. There was a significant association of knee and ankle pain with low back pain. The lower extremities provide a stable base for the lumbar spine motions and control ground reaction forces to the lower back. Lower extremity pain can interrupt these processes and may transfer excessive loads to the lumbar spine, which can lead to low back pain. The human body has a multi-segmental structure, initiating major and powerful interactions between adjacent segments. The pelvis is situated in the center of the body and connects the movements of the lower limbs to the segmental motion of the spine. The pelvis is a functional link through which loads are transferred in a proximal and distal manner. Excessive pronation in the foot may cause misalignment of the lower extremity, frequently leading to structural and functional deficits in both standing and walking. Hyperpronation influences timing and intensity of lumbosacral muscle activation, thus giving rise to low back pain and or other biomechanical dysfunctions. The kinetic chain of the low back down to the feet involves the lumbar spine, the pelvis, the hips, the knees, the ankles, and the feet. Think of all the bones that are involved in that motion. There are a large number of joints, muscles, tendons, and ligaments. If something is not functioning properly along that chain, another area has to take a greater workload. And that greater workload often leads to pain or symptoms in the second area that is compensating for the first area that is not functioning properly. If there is something going on in the lateral aspect of the ankle, say the ankle ligaments on the lateral side are just not supporting the ankle the way that they should, this will lead to an altered gait. This can cause pain or symptoms in the knee, in the thigh, in the hip. It can cause the pelvis to be shifted in one direction, to shift laterally, left or right, to rotate left or right, or just to be not functioning the way that it should. And then that puts an additional stress on the lumbar spine. Muscles from the lumbar spine attach to the pelvis. Therefore, they also have to carry a greater workload if the pelvis is not moving or functioning properly. So this is what I'm speaking about with the kinetic chain. If there is one thing that is not functioning properly, the rest of the area has to take a greater workload. And this excessive workload can lead to pain or symptoms throughout the entire chain. I had already mentioned pronation or hyperpronation. Pronation is a natural movement of the foot that should occur every time we step down. Hyperpronation is an excessive amount of pronation. This can lead to an alteration in posture and in function when we are moving. This altered gait can change the way that the entire lower extremity moves. It can put pressure on the knee joints and the muscles that move the knee joints and the ligaments that support the knee joints. It can affect the hip joint and the muscles that move the hip joint in any direction and the ligaments that support the hip joint. It can also alter motion in the pelvis and in the lumbar spine. That is why lower extremity dysfunction or lower extremity pain and symptoms can lead to low back pain. You want to do everything you can to eliminate this source. Do everything that you possibly can. If you have a condition in the foot or the ankle, rehab that condition. First of all, you have to recognize that there is a problem, because there may not be pain or symptoms, but there may be an alteration in the way that you're moving or just how something feels when you are moving or exercising or performing your sport. You have to look at the entire body as one synergistic unit. Figure out what your weak points are. Train those weak points. You can train your feet by strengthening them. You can train your ankles by strengthening the ankles and the muscles that move the ankles. You can use the Bosu ball to strengthen the entire lower extremity. The hamstrings are often an area that is weak. You can perform hamstring strengthening exercises like the pelvic bridge and also the glute ham raises. That's an advanced exercise, so always start with the pelvic bridge and then build up to a glute ham raise. You can have weakness in the gluteus medius muscle. If that is the case, then strengthen the gluteus medius muscle. Finding the weak point and training that weak point and eliminating that weakness will help to lessen lower extremity injuries and dysfunction as a contributing factor to low back pain. You can see a doctor of chiropractic like myself. You can work with a fitness trainer or a rehabilitation specialist. Have them see the way that you move, your muscle sequencing, how your gait is. Because you may have an alteration in your gait, and you also want to look at how you move when you are fatigued, because many times these issues do not occur until the muscles start to fatigue. You may have an external rotation of the hip that doesn't occur until those muscles start to get fatigued, and then it may become very noticeable, and that can put an excessive stress on the hip, on the pelvis, and on the low back, leading to a low back condition. So you always want to work with a professional to help yourself to figure out exactly what needs to be strengthened. Now it is time for the disclaimer. Disclaimer, disclaimer, disclaimer. Viewing this video does not take the place of working with a medical professional, a rehabilitation specialist, or a fitness professional. Always see a medical professional to make sure that you are healthy enough for exercise and to make sure that the exercises that you are doing are not contributing to any pain or symptoms that you are feeling. When performing an exercise, always work through a symptom-free range of motion. If an exercise elicits or intensifies symptoms, you want to stop immediately and find a viable substitute. Again, never perform an exercise that elicits or intensifies symptoms, and always work through a pain-free or symptom-free range of motion in every exercise that you perform. It doesn't matter if it's a stretching exercise, strengthening exercise, or motion exercise. Start at your current health and fitness level. Do not start at the level that you were at before you were injured, or please do not start at the level that someone else is at or the level that you used to be at. Start your training or restart your training or your rehabilitation program at your current health, fitness, and strength levels. Exercise and manual therapy such as chiropractic and massage are the most common non-invasive and conservative interventions for low back pain. Strengthening the intrinsic and extrinsic foot muscles contributes to improving posture. Once you have recognized an area that is dysfunctional in the lower extremity, train that area and start to rehabilitate that area so that it functions properly. Train hard, but train smart. Like I said before, start at your current health and fitness level. If it is your foot, you may have weakness in your foot. You may suffer from hyperpronation. Perform foot strengthening exercises. I have a video on foot strengthening exercises. I will put a link to that video, but please strengthen your feet, and it will help to combat any dysfunction that you may have in the feet. When we speak about the ankles, you may need to do Bosu ball exercises. I have 3 videos on Bosu ball exercises that you can watch to learn how to do them properly. This is going to help to strengthen the ankles and the entire lower extremity on an unstable surface. If the issue is with your hamstrings, then like I stated before, strengthen the hamstrings. You could perform the pelvic bridge exercise, and you can then advance to the glute ham raise exercise. And there are a ton of other hamstring strengthening exercises also. You want to make sure that you always work through a symptom-free range of motion, whatever exercise you are performing. Eliminating dysfunction and pain and symptoms in the lower extremity is key in the prevention and rehabilitation of low back pain. Do yourself a big favor and strengthen the areas that need to be strengthened in the lower extremities. Eliminate the dysfunction in the lower extremities, and this will help you to prevent and rehabilitate any symptoms that you may have in the lumbar spine. Thank you everybody for watching today's video. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. You can visit my website, championshipchiropractic.com, where you can get additional information on the book. Also on my website, you can find the link to my blog. My blog contains articles on spine health, sports medicine, health, fitness, and nutrition. So please visit my website at championshipchiropractic.com. Please feel free to like this video. If you have questions, feedback, or suggestions, please leave them in the comment section below. Also, please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. Thank you again for watching, and always remember to train hard, but train smart. Get adequate rest between your training sessions. Please utilize nutritional and supplementation strategies that work for you. Stay injury-free. Completely rehabilitate your injuries and accomplish your goals.